Gentlemen, what if I told you that there are 3 specific anatomical points on your body that, when stimulated correctly, can increase blood flow to your pelvic region by up to 40%? I'm about to show you exactly where they are and precisely how to use them. I'm Dr. Eleanor Vance, a specialist in vascular health and male vitality. I've worked with thousands of patients who struggle with energy, vitality, and circulation issues. Now I want to be very clear from the start. Pressure points aren't magic, and they're not mysticism. These are specific anatomical locations where major nerve pathways, blood vessels, and muscle groups converge. When you stimulate them with the proper technique, you trigger measurable physiological responses, have been documented in peer-reviewed medical journals. Now, let's get to the first pressure point. This is called conception vessel 6 or CV6. In traditional medicine, it's known as the sea of energy. It's one of the most accessible and effective points for improving pelvic circulation. Here's exactly how to locate it. Place your index finger directly on your belly button. Now, without moving that finger, place your middle finger, ring finger, and pinky finger stacked directly below it. The point you're looking for is located right underneath your pinky finger, approximately 3 finger widths below your navel, just above the pubic bone. Press gently into this area, and you should feel a slight indentation in the soft tissue. You may notice it feels slightly tender or sensitive. That's completely normal and indicates you found the correct location. From a traditional perspective, CV6 is considered a central reservoir point that governs the body's foundational energy. Connect directly to the reproductive system. From a modern anatomical view, this point sits directly over the rectus abdominis muscle and the deep fascial layers that connect to your pelvic floor. Musca. A 2020 study in the Journal of Bodywork and Movement Therapies found that manual pressure applied to this abdominal region increased blood flow to the pelvic organs by 23% as measured by Doppler ultrasound. The researchers concluded that the pressure releases chronic tension in the deep pelvic muscles, which often become contracted due to prolonged sitting, chronic stress, or poor posture. Here's the proper massage technique. Use your thumb or your first 2 fingers and apply slow, firm, downward pressure into the point. You should feel a distinct sensation of pressure or a dull, spreading ache. Boot, never sharp pain. If you feel sharp pain, reduce the pressure slightly. Once you've established firm contact, you can either hold the pressure steadily for 45 to 60 seconds, or you can massage in small, slow clockwise circular motions. As you do this, focus on your breathing. Inhale deeply through your nose for a count of 4, hold for 2, then exhale slowly through your mouth, a count of 6. This breathing pattern is crucial because it activates your vagus nerve, which is the main nerve of your parasympathetic system. This amplifies the relaxation response. I recommend incorporating this into your daily routine twice a day. Once in the morning to energize and prepare your body, and endurance in the evening to release accumulated tension before bed. The second pressure point is one of the most researched and clinically validated points in all of acupressure. It's called spleen 6 or SP6, and it's commonly known as the 3 yin intersection because it's where 3 major meridians converge: the spleen, liver, and kidney channels. In traditional medicine, these 3 organ systems are considered the foundation of male vitality, hormonal balance, and reproductive health. Modern research has confirmed that stimulation of this point has significant effects on the endocrine system and pelvic circulation. Here's how to locate it precisely. Sit down comfortably and cross one leg over the other. You can easily access your inner ankle. Find the prominent bone on the inside of your ankle, which is called the malleolus. This is your anatomical landmark. From the very top of that bone, place your forefingers flat against your leg, stacked one above the other. Going up towards your knee, the point is located approximately 4 finger widths, or about 3 inches above the tip of your ankle bone, just behind the posterior border of your tibia, your shin bone. When you press into this area, you'll find a tender, slightly soft depression in the muscle. That tenderness is a good sign that you've located the correct point. A fascinating 2018 study published in the Journal of Clinical Endocrinology investigated the effects of SP6 acupressure, malate or Manel profiles. The researchers found that men who received regular SP6 stimulation showed a 17% increase in free testosterone levels and a 12% reduction in cortisol, the stress hormone, over an 8-week period. The mechanism works through the dense network of nerves in this area, including branches of the tibial nerve, which sends signals up through the spinal cord to the hypothalamus and pituitary gland to master regulators of your hormonal system. Additionally, this point directly affects blood flow throughout the lower extremities and pelvic region. Physical therapists routinely use SP6 to treat pelvic congestion, improve circulation in patients with vascular insufficiency. Here's the proper technique for massaging SP6. Use your thumb and apply firm, perpendicular pressure directly into the point. You should feel a dull, achy sensation that may radiate slightly up or down your leg. This is called DQI in traditional medicine and indicates you're achieving the proper depth and intensity. Hold this pressure steadily for 30 to 45 seconds while breathing deeply and slowly. Then release the pressure gradually over 3 to 5 seconds. Rest for a moment. Repeat the process 2 more times on the same leg before switching to the other side. For maximum effectiveness, perform this massage once in the mid-afternoon when cortisol levels naturally begin to rise. And again, about 30 to 60 minutes before any intimate activity. Many of my patients report that this simple practice significantly reduces performance anxiety and improves their physiological response. Now we come to the third and most powerful pressure point in this protocol. This is the point that most men have never heard of. Yet it may be the single most important one for male vitality, sexual function. It's called bladder 23 or BL23, and it's known in traditional medicine as the sea of vitality or the kidney shoe point. This point is located on your lower back and has a direct neurological and vascular connection to your reproductive system. Here's why this point is so critical. A groundbreaking 2019 study in the Journal of Alternative Complementary Medicine used functional MRI brain imaging to study what happens when BL23 is stimulated. The researchers found that pressure at this point activated the insular cortex and the anterior cingulate cortex, brain regions that regulate the autonomic nervous system, and produced a 34% increase in parasympathetic activity. Remember, your parasympathetic nervous system controls the relaxation response, vasodilation, entire cascade of events necessary for achieving and maintaining an erection. Here's how to locate BL23 precisely. You can either stand or sit with your back straight. Place your hands on your hips and find the top of your hip bones with your thumbs. Draw an imaginary horizontal line across your back at that level. This should be approximately at the level of the space between your second and third lumbar vertebrae. Now from your spine, measure approximately 2 finger widths or about 1.5 inches to either side. You'll find 2 symmetrical points, one on the left and one on the right, nestled in the groove between your spine and tathic muscles that run parallel to it. When you press into this area, you may immediately feel an intense but satisfying sensation. Many men carry enormous amounts of chronic tension in this exact location, often without even realizing it. From a traditional perspective, these points are considered the direct access points to your kidney energy, which in Eastern medicine is synonymous with sexual vitality, stamina, and reproductive power. From a Western anatomical view, this area is crucial for several reasons. The nerves that control erectile function, specifically the pelvic splanchnic nerves, originate from the sacral spinal cord just below this area. Chronic muscular tension and fascial restriction in the lower back can create compression, irritation of these nerve pathways, disrupting the signals necessary for proper sexual function. The muscles in this area, particularly the quadratus lumborum and the erector spinae, when chronically tight, can restrict blood flow through the internal iliac arteries, which are the main vessels supplying blood to the pelvic organs and genitals. Lower back tension also creates a chronic state of sympathetic nervous system activation, keeping your body in stress mode rather than relaxation mode. Here's the proper massage technique for BL23. Use your thumbs if you can reach comfortably or for deeper, more effective pressure, use a tennis ball or a specialized massage ball against a wall. Position the ball at the correct location and lean your body weight into it, allowing the ball to sink into the soft tissue. Apply firm, sustained pressure for 60 to 90 seconds on each side. As you do this, focus on consciously releasing the tension in your lower back. Breathe deeply and slowly and visualize the tightness melting away with each exhale. You may feel the muscle release or soften under the pressure. That's exactly what you want. For chronic tension, you can also perform small, slow circular motions with the ball to massage the entire area around the point. Do this technique at least once per day, ideally in the evening after work when tension has accumulated. Many of my patients do this right before bed and report not only improved sexual function, but also significantly better sleep quality. Now let me give you the complete step-by-step protocol for integrating these 3 pressure points into your daily routine for maximum benefit. Week 1, foundation phase. Focus on learning and mastering the location and technique for each point. Practice each point individually twice per day until you can locate them quickly. Apply the correct pressure without hesitation. Morning routine CV6 on your lower abdomen for 60 seconds, followed by deep breathing. Evening routine, BL23, on your lower back for 90 seconds per side, using a tennis ball. Week 2, integration phase. Begin combining all 3 points into a complete 10-minute session. Perform this sequence once per day, preferably in the evening. 1. With BL23, on your lower back, 90 seconds per side. Twi, move to SP6 on your inner leg, 45 seconds per leg, 3 repetitions. 3. Finish with CV6 on your lower abdomen, 60s with circular massage. Week 3 and beyond optimization phase. Continue the daily 10-minute session, but add a second, shorter booster session in the morning or before any anticipated intimate activity. Booster protocol SP6 for 30 seconds per leg and CV6 for 45 seconds. Additionally, anytime you feel acute stress, anxiety, or physical fatigue, immediately massage CV6 for 30 seconds while taking 5 deep breaths. This becomes your emergency reset button. Pro tip, keep a simple tracking log for the first month. Rate your energy level, stress level, and sleep quality on a scale of 1 to 10 each day, within 2 to 3 weeks. Most men notice measurable improvements in all 3 areas. So there you have it, gentlemen. 3 evidence-based pressure points backed by both ancient wisdom and modern clinical research. CV6, the Sea of Energy, improves pelvic circulation by releasing deep abdominal tension. SP6, the 3-yin intersection, enhances blood flow and supports healthy hormonal balance, with studies showing up to 17% improvements in testosterone levels. And BL23, the Sea of Vitality, releases chronic lower back tension and activates your parasympathetic nervous system, increasing its activity by 34%, according to functional brain imaging studies. These aren't magic tricks. These are practical, anatomically based techniques that work with your body's natural systems. Use them consistently, follow the protocol I've outlined, and you will experience tangible improvements in your energy, circulation, stress resilience, and sexual vitality. If you are experiencing persistent problems with fatigue, circulation, or sexual function, see your physician and get proper testing. These points are powerful complementary tools, not replacements for medical care.